Dr. Julissa. How are you?
I am awesome. How are you?
I was sharing with SourceNation that, tonight's conversation is all about fibroids. But before we get into that, if you will, Dr. Julissa, we have brand new family members that are tuning in right here. This is our very first show in the new year. So, if you will, if you could just introduce yourself to everyone listening to Healthy Living and, of course, the SourceNation family, that would be great.
Thank you so much, Kathy. Happy New Year, SourceNation. I am Dr. Julissa Hernandez, naturopathic doctor, practicing for 20-plus years, an international speaker of natural medicine, teacher of natural medicine as well, and television and radio personality, also known as the resident naturopathic doctor of the Michael Basin Show for 9 years, and I'm absolutely honored to be a part of this platform to be able to share with you as much information as Kathy and I can so that you all achieve optimum health. Thank you, Kathy, for having me.
Awesome. Thank you, Dr. Julissa. Tonight's conversation, SourceNation, you can definitely follow us at drjulissa.com. Again, drjulissa.com. The article for tonight's conversation is Uterine Fibroids, Preventing, Shrinking, and Avoiding Surgery. And Dr. Julissa, if you don't mind, I want to share something with SourceNation. I want to read the first of the article so they can get a full understanding of exactly what we're going to be discussing tonight, because there are questions that I know that will be coming in as we are speaking on this subject matter. And in the article it reads, most women with fibroids suffer severe discomfort, distant belly, pain, and excessive bleeding, and the proposal of surgery by most of their allopathic doctors is all too common. But some have used alternative methods to help the body heal, shrink fibroids, and avoid surgery. Let's talk about that in regard to the pain that they're feeling, the excessive bleeding, and then having the option of surgery. Talk to us about that. Why is that so important?
Well, I see it on a constant basis in my office, women that are having issues with these challenges, and it's way too common. For those that are following along with the article there, you'll be able to see that I even placed in bold that uterine fibroids by the age of 35 are suffered by 60% of African American women, and it's increasing to greater than 80% by the time they're the age of 50. So it's something that I'm seeing that's way too common, and it's also one of the topics that I've discussed the most in most of the radio interviews I've had in my professional career. It's been a very significant topic with regards to female reproductive system health. So I felt that it was something to always touch upon, and I'm so glad that your listeners are also wanting to hear more about it, because they do have other options. It's not always a necessity to go the surgical manner. There are ways to help the body to heal from that, especially if they learn, Kathy, what are the things that aggravate fibroids, what are the things that feed them, and what the actual causes of their ailments is.
Okay. Now, looking at the article, and I want to say right where we are, because you give us some percentages here, and it basically said, just as you stated, uterine fibroids by the age of 35 was 60%. Among African American women, increasing to greater than 80% by 50, whereas Caucasian women showed a incidence of 40% by the age of 35 and almost 70% by the age of 50. Talk to us about the percentages, and why is it so great within African American women than any other ethnicity?
Okay. I really have to say that a lot of it does have to do with diet as well.
Okay.
Unfortunately, and I would say that with that percentage, although Hispanic women don't reflect there, they're right there with African American women. So let me just group us all together in the sense that our cultural norms with the way that our diet consists of, with regards to a lot of meats that are very hormone ridden. All right.
Okay.
We're also talking about mainly diets that are very high in fat, not very vegetarian based. Also lifestyles that tend to cause a lot of liver congestion. Let's say if it's even alcohol consumption to things of that sort. So sometimes even slight weaknesses of the liver, where the liver is the filter of hormones, and it's not filtering estrogen the way it should. If that's inherited, it could be an issue as well of why more Hispanic women and African American women tend to suffer from that more than Caucasian women do, for example. Okay. So that hormonal imbalance will definitely put us on a path of having issues of these benign growths that tend to develop in the reproductive system that way. So, yes, I would say diet is a big part of that.
Because I was going to say, we had a couple of questions that came in that asked the specifics of the cause. And when you stated diet, I know a high content of fat, a high content of possibly salt can contribute to that. And then basically not having a exercise regimen or some form of activity in your daily life can contribute as well. Now, and thank you so much for sharing that. Let's about some of the things that we are taking in that we shouldn't. I mean, because we talked about the high content of fat, possibly salt, but there are things that we are eating and drinking every single day and not aware that this could cause that.
Apart from the fact that high fat must be reduced, most definitely in the diet, because unbalanced estrogen levels are a big contributor. If we're talking about specific foods, yes, I'm going to go there, and I'll talk to you about one of the very first things that I will recommend a woman remove from her diet is coffee. And there are studies already that show that coffee clearly aggravates fibroids. A woman that has uterine fibroids must avoid caffeine foods altogether, even things like chocolate and carbonated beverages of all kinds. Anything with bubbles, ladies, you've got to stay away from. Even if it's that little bit of champagne that you think you're going to have once in a while. Yes, anything carbonated, chocolate, anything with caffeine is going to do that. Coffee is going to do that. However, I do want to make clear that green tea and white tea are not going to cause that effect because they're not a toxic caffeine. So please let me just make sure that that is understood. But also starchy pastries, Kathy, very fatty dairy foods, hormone-laden meat, sugary foods. All of these things also cause an iodine deficiency. So I want ladies to open up their ears if they've been told that they have a thyroid imbalance, hypothyroidism, and so on, because the hormone-laden meats and the sugary foods cause the iodine deficiency. They then, in turn, are having issues with the hormonal imbalance because the thyroid very much plays a part in that. So it's a chain reaction to then having that estrogen overload, and then, boom, you're more susceptible to the uterine fibroids. Everything in the body is interconnected in that sense. So,
good information. Now, let me ask you, Dr. Julissa, let's just say what we have listed here, like if you're drinking coffee, if you're intake of chocolate, sodas, teas, let's just say you don't have that as part of your diet. Can you develop fibroids still?
Absolutely. If there's an overloaded liver, most definitely. An overloaded liver can be caused by the estrogen dominance, even of eating certain meats. If you're not having those, but if you're eating a lot of hormone-laden meats, if you're ingesting high amounts of alcohol, if you have an overloaded liver, that'll do it. Even if you're one, let's say, doesn't consume alcohol, let's say you don't really ingest a lot of hormone-laden meats. Well, let's say that you take a lot of medication. And remember that the liver is the chemical plant of the body. If the liver is overloaded, if it's overloaded with a lot of toxicity. Let's talk about a woman that even is on birth control, okay? If she's on the pill, the liver is the one that has to filter all that drug, all those chemicals. The liver is the one that has to do that. If the liver becomes overloaded, you're going to suffer from estrogen dominance, and then you're at risk for uterine fibroids to develop. So anything in that context will cause that as well.
You know, Dr. Julissa, as long as we've been doing the Healthy Living show, we always talked about what you can incorporate into your diet. Let me ask you, are there any types of vegetables, any type of fruit that you would suggest if someone has fibroids just to bring their body back into balance? What are your thoughts about that?
Absolutely. Even in the treatments that I give to my patients that have uterine fibroids, I actually use a supplement that's derived from cruciferous vegetables. And I say that because indole 3-carbinol, for example, is a substance that's found in cruciferous vegetables like broccoli, cauliflower, cabbage, Brussels sprouts that specifically helps to reduce high levels of estrogen dominance in the body. And that, in turn, has helped my patients in 20 years of practice that I have to help their bodies shrink the fibroids on their own, because we're cutting off that food that they need of that excess estrogen. So we're reducing those levels in the body, and then in turn the body can start to help itself shrink those uterine fibroids. So most definitely write down, ladies, the broccoli, cauliflower, cabbage, Brussels sprouts, absolutely. And then if you're talking about fruits, high fiber fruits like apples are the best at helping the body excrete excess estrogen. Okay, so it helps the body to help eliminate that on a better level. Of course, when I do talk about vegetables and fruits on your program, Kathy, I want people to understand that I'm definitely talking about organic fruits and vegetables, because you do also want to stay away from the pesticides and the GMOs and all the stuff that they spray on the regular quote unquote fruits and vegetables. And then again, you're bombarding your liver because your liver has to filter those pesticides and GMOs. So what you want to do is avoid that and go organic.
Good information. Now, I want to talk about the area of treatment and treating them naturally. But before we do that, Dr. Julissa, talk to us. Although I have never experienced fibroids, I've heard that it is a great deal of discomfort, whether you're on your menstrual cycle or going through menopause. Talk to us about that. Why is it so painful? Is it because of the size of the actual growth?
It depends on the woman. The uterine fibroid doesn't have to be necessarily large to cause her pain. What we're talking about is it's a walnut. They're usually the size of a walnut to an orange. Okay, sometimes the size of a very small fetus, okay, and they appear on the uterine wall. Now, what they're comprised of is fibrin, in other words, scar tissue, okay, and it's smooth muscle tissue and excess estrogen. That's what comprises a uterine fibroid: scar tissue, smooth muscle tissue, and excess estrogen. And so it really depends on the woman, okay? If she has a very small pelvis, we're talking about something abnormal there, or a small growth there that can cause excessive menstrual bleeding, most of the time with clotting, okay? It can cause serious pelvic pain, bladder infections as well. A lot of women think that they don't really understand why they keep getting bladder infections and they keep constantly getting them. Yes, it could be the cause of a presence of uterine fibroids. That's something a lot of women need to look at. Irritable bowel syndrome, also very much linked to the presence of uterine fibroids. So sometimes you'll have a woman that is suffering from uterine fibroids and also has that issue of even when they're eating or when they have an empty stomach, they have that extreme irritability and discomfort in the abdominal area, but it's more digestive as well. They also have issues of suffering from painful intercourse because there's pressure on the cervix, pressure in the pelvic area. And, of course, then it can cause issues of infertility that even can cause miscarriages, which many times can be painful for a woman as well.
Yes, very, very much so. And I want to talk about treating them naturally. opposed to having surgery. What are your thoughts about that?
What I recommend to my patients immediately is to make lifestyle changes. They must make changes to a more, the first thing is to make changes to a more low-fat vegetarian diet, specifically to help alleviate the symptoms right away. All right? So what I've stated there in the article and what I've mentioned here today, removing those high caffeine, toxic caffeine-rich foods, removing the hormone-laden meats and so on, bringing in more a healthier type of protein from, for example, nuts and things of that sort. But then we're also talking about certain herbs that are really going to help that process. I love to use a Chinese formula that is wonderful for helping the liver to filter excess estrogen. I use one specifically called the liver balancing formula. I love to use a combination of Chinese herbs to help detoxify the body in general, because most of the time it's a woman that has a very toxic body. Again, we're talking about most cases an overloaded liver. So I love to use that in those cases, and of course to help the body also absorb a lot of those excess, a lot of that excess estrogen. I love to use fiber supplements as well to help with elimination and to help absorb that excess estrogen, so they eliminate it through the intestinal tract. And of course, I mentioned the Indole 3 carbinol supplement, which is derived from cruciferous vegetables. I tell the ladies they should try to have broccoli on a daily basis, even if it's steamed, even if it's raw. Okay, they can cut the stalks and just eat the florets. And I get some crinkled faces in the office when I tell them they have to start eating broccoli. So that's why in those cases, I mean, seriously, it's like, you suffer from these issues and they're still giving me a face when I say eat broccoli. What am I going to do? So I give them a supplement that is going to do the function that I need it to do. I'm real on here. I have to tell you how it is. I have to see it. It's so funny. They're like, oh, really? And like, it's almost like they would rather go through surgery instead of eat broccoli. I can't take it. Like, it's too funny. But, yes. So then I give them a supplement that's going to do the job. There you go. And what I do in that case is, if I know where they're at that point, I must tell you, I am usually the last resort when they've exhausted all of their visits to their conventional doctor. When they've exhausted all the visits to the gynecologist, they've maybe been to 2 and gotten second opinions and so on, and they're told, okay, well, I recommend this, and you may have to have surgery. Well, we may have to do surgery, maybe not, and they're still in the air, and they don't want to remove their female plumbing. They feel, okay, if I'm born with it, I don't want to get rid of it, or I want to have another child, and they're telling me that I need a hysterectomy. Dr. Julissa, help me. So those are usually, Kathy, the patients that I get. So when I'm already at this point with them, I know how many fibroids they have, although I can see trauma in the uterus in my diagnosis, in my analysis. I see traumas. I can see that there are challenges of the uterus. I see that in my analysis. So by the time they come to me, they told me, okay, I have this many fibroids, and they're this big, and so on. What I do is, after they begin treatment with me, I tell them in 3 months to go and get another sonogram, go to their doctor once again, and to let me know if they even still have fibroids. And if they still do, I want to know how much smaller they are, because they do shrink. And I want to know the sizes, in other words, or whatever it may be, because I work together with their doctors to do that as well, so that they can see the process that I've done with them. And many of the doctors become amazed. They just say, keep doing what you're doing. You don't need surgery any longer. Or, and I've helped women in 49 years old become pregnant with uterine fibroids. Really? It can be done. It can be done. You just have to nourish the body.
Right. And I love that. I love the fact that, now that we have natural remedies, and I will tell you, I used to take any type of pain I had, I would just get something over the counter, but now I truly believe in treating whatever ailment that I may have naturally. I think that when I do, I feel much better knowing that I'm not taking anything that's chemically based. Everything is all natural. And the fact that you can truly treat uterine fibroids in a natural way is amazing. SourceNation, we are speaking with our resident naturopathic doctor, Dr. Julissa Hernandez, and tonight's conversation is all about uterine fibroids, the prevention of fibroids, and the alternative of having surgeries to holistic. Dr. Julissa, we have a couple of questions that have come into the studio, and most of it you have really answered for us. But one question I found very interesting, and I know you'll have a good answer for this. How fast does the fibroid grow?
Every woman is different. There's no clock. Yes, there's no clockwork at a specific answer to that. Every single woman is different. Just like the rate of shrinkage could be different. If she's made truly significant changes, or she just cold turkey said, I am not ingesting this anymore, instead of gradually reducing certain things that I recommend they eliminate, like other patients, like some patients have done, or so on. It depends on the woman. There's no specific answer to that.
Okay. All right. Thank you for that. And then, of course, our final question that has come in from our Facebook family. In regard to fibroids, what symptoms should a young lady look for if she feels as though she may be experiencing that? What are the symptoms of fibroids?
Okay. Breast swelling is one thing that I would say women look for, and a lot of women don't take that into consideration. Breast swelling is one that they need to look at. Painful uterine bleeding, painful periods that they didn't used to experience before, okay? Excessive bleeding, but accompanied with the clotting that I mentioned. If you never suffered from cramps and pelvic pain before, and it's not a simple cramp, again, women should never have menstrual cramps, okay? However, pelvic pain they need to consider. I mentioned before that if you tend to get recurrent bladder infections and you really don't understand why, let's say your diet hasn't changed, your sexual partner hasn't changed, you're not having sex unprotected, and there really shouldn't be a reason for you to be having this issue, look into that as well. Painful intercourse, another symptom you need to look into. And if you have been trying to conceive for a year and still have not become pregnant, or have become pregnant and had a slight miscarriage, but you've never had sonograms to see or really look in there to see what's going on with the uterine wall, then I would say look into having someone check to find out if there could be a fibroid challenge going on. Unfortunately, they're more common than blue eyes, uterine fibroids. It's not necessarily cancer. Fibroids are not cancer. Less than 0.5% turn to that. Turn cancerous before menopause, but it is an issue that too many women are dealing with, and those are the symptoms that I would say to look for.
Good information, and thank you so much, Dr. Julissa. As we're wrapping up, I always like to leave either with some encouraging word or possibly some advice that we have not shared in tonight's conversation. If you wish to contribute at this time, I would love you to do so.
Of course. Thank you so much, Kathy, for having me. I'll leave off with this one last point as well. Please understand, ladies, that just because other family members, grandmother, aunts, your own mother, had uterine fibroids, this does not doom you to have to suffer the same. Yes, genetics is a bummer. It is true. We will, inherit some genetic tendencies, but that does not mean that you can't prevent. And I would say the number one thing that a woman can do to prevent this challenge, or better yet, help their body start to heal from it, is to definitely change their eating habits. An Italian scientist did a study that showed that women who eat large amounts of vegetables cut their fibroid risk in half, while women that were eating red meat doubled their risk. So that I would definitely say, if it runs in your family, if you have uterine fibroids, eliminate red meat from the diet completely. Start stuffing your